Hi, Steve. I just wanted to talk with you today about your son's Ventolin mask. So I saw when we were in the room and the nurse actually put the mask on your son's face, he was screaming and kicking and everything. Is there any reason that he's so frightened about the mask?
I really don't know. He's scared to death of it when you put it in there on his face. But I was beginning to think that maybe it has something to do with the fact that my wife's father died of COPD, and we had visited him in the hospital, and Brandon had seen him with a mask on his face,
Oh, okay.
and he kind of related that to the fact that he died having the mask on his face. So I'm not sure if that's in his mind. He thinks that the reason why he died was because he had that mask on his face. So that may be the reason why he's afraid of it.
Oh, I can completely understand that then. It must be like traumatizing for a little boy to see his grandpa die and then have the mask on his face as well. So I was talking with the doctor earlier, and since Brandon's going to be discharged in a couple days, we figured that the doctor actually told me that we could give him the Ventolin inhaler instead. Would that be something that you guys would be interested in?
Yeah, if you could show me like how to use it, because we're going to be going home in a few days. And the problem that I had was when the nurse came in, she didn't exactly explain what she was doing. She just come in and was doing her job. So we had a lot of questions as to how it's applied, the effect of it, and how we could use it once we get home.
Oh, okay. Well, I'm very sorry that the nurse just came in and didn't explain anything to you, but I can explain everything to you now. I actually have a Ventolin inhaler with this is called an aero chamber. So pretty much what it is, it makes sure that Brandon gets all the medication, and it has a little mask on it, but it's not anything permanent. He just uses it for his one puff dosage that he has. So pretty much how it works is you have your Ventolin, and then the Ventolin will have a cap on it, and then you just remove the cap, you attach it to the actual aero chamber, and you shake it.
Okay.
And then it has the mask on it, and then just get him to breathe out or exhale. So just exhale, and then he puts it up to his face. Just make sure there's no openings on his face, and then he does the puff. And then we say just to take 5 or 6 normal breaths, and that way the mask will make sure that he gets all the medication, and the aero chamber actually holds the medication. So
Okay,
this
sure.
would be much easier, than wearing the full mask, right? If
Okay.
that's something you're interested in.
So it's just 5 to 6 puffs, and then
Well, 5 to 6 breaths, one
5 to 6
puff.
breaths.
Yeah.
Okay. Okay.
And then how you wash it after is you remove the Ventolin again, and these parts actually come apart. Like everything
okay.
comes apart, and then you can just wash it in lukewarm water, and you don't need any soap or anything. So it's very easy to use, and that way he doesn't have the actual mask on his face. It's
Okay.
just
Sure, we'll try it.
okay.
I'm not
Perfect.
guaranteeing that he's going to like it, but I mean, we'll see how it goes.
Okay, perfect. Okay,
Okay.
sounds good.